Hello students, today's topic is joints of the skeletal system. Joints are nothing but the articulations which are joints or functional junction between the two bones or the sites where two bones meet. They bind the part of the skeletal system and makes possible the bone growth, permit parts of the skeleton to change their shape during the childbirth, and also enable the body to move in the response to the skeletal muscle contraction. So joints are responsible for the articulation as well as movement. Joints can also be grouped according to the degree of movement possible at the bony junction. So there are three types of joints dependent on the degree of movement. Synarthrotic joints, which are immovable joint, amphiarthrotic joints, which are slightly movable joints, and diarthrotic joints, which are freely movable joints. Joints vary considerably in the structure and functions. However, they can be classified by types of tissue that binds the bone to each joint. So, dependent on the structure and functions, there are three types of joints: fibrous joints, cartilaginous joints, and synovial joints. Coming on to the fibrous joints are also named because fibrous tissue holds them together. In a fibrous joint, there is no joint cavity present like that of synovial cavity, but most fibrous joints are immovable. They lie between the bones that closely contact with one another. Fibrous joints are again divided into three types. First is syndesmosis, which is the joint between distal end of the tibia and fibula. Second is suture joints, which are the joints between flat bones in the skull. Third is gomphosis, that is the joint between root of the tooth to the jawbone. So these are fibrous or immovable joints. Next type of joints is cartilaginous joints. The name itself indicates the cartilage is present between the joints. The cartilage is of type hyaline cartilage or fibrocartilage that connects the bones of the joints. Cartilaginous joints are again divided into two types: synchondrosis, that is the articulation between the first rib and the manubrium; symphysis, for example pubic symphysis in the pelvis. So the example of cartilaginous joints: pubic symphysis, synchondrosis between the rib and sternum. Next type of joints is synovial joints. Synovial joints, most of the skeletal system consists of synovial joints because synovial joints allow free movement and they are diarthrotic. These joints are more complex structurally than fibrous and cartilaginous joints. Synovial joints have got particular features. First, they consist of articular cartilages which are present at the end of the bones which are articulating. They consist of joint cavity, which is also known as synovial cavity, and they give the space for the fluid called as the synovial fluid. Articular capsule, which is also known as joint capsule, it encloses the joint cavity. Synovial fluid is the fluid which is present within the synovial cavity or joint cavity. Reinforcing ligaments are the synovial joints are reinforced and strengthened by a number of band-like ligaments which are called as reinforcing ligaments. So these are these particular structures which are present and unique in the synovial joints. Bursae and the tendon sheaths. They are not strictly associated with the synovial joints but are often found associated with the synovial joints. Bursae are flattened fibrous sacs which are lined with the synovial membrane and contain a thin film of synovial fluid. Tendon sheath is an elongated bursae that wraps completely around a tendon subjected to friction. So this is the structure of bursae and tendon sheaths. Next, dependent on the movement, synovial joints are again divided into 6 types. First is ball and socket joint, wherein a socket is present and the head of the bone is articulating with it. Hinge joint, next type, pivot joint, saddle joint, gliding joint, and condyloid joint. First, ball and socket joint. Ball and socket joint consists of a bone with a globular or slightly egg-shaped head which articulate with the cup-shaped cavity of the other bone. Such joints allow a wide range of motion than does by any other kind of joints. This type of joint permit the movements in all planes as well as rotation movements around a central axis. Example, hip and shoulder joints are forming or type ball and socket joints. Next is condyloid joint. Condyloid joint is a joint between oval condyloid of one bones which fit into the epileptical cavity of the other bones. This type of joint permits a variety of movements in the different planes. Then form the rotational movement which is not possible. Condyloid joint is the joint between metacarpals and phalanges and the radiocarpal joints. Next is gliding joints, or also called as plane joints. These consisting of articulating surfaces of gliding joints which are nearly flat or slightly curved. These joints allow sliding or back and forth motion and twisting movements. Gliding joints, these are the joints between wrist and ankle, bones of wrist and ankle. The articular processes or of adjacent vertebrae, joint formed by ribs 2 to 7 connecting the sternum, are also gliding joints. The bones glide over each other in this type of joints. Hinge joints, it is a convex surface of one bones articulates with the concave surface of the another. Example is the joint between the humerus and the ulna. Such joint resembles a hinge of a door that permits the movement in one plane only. That is the elbow joint between the ulna and the humerus, and the joints between the phalanges. Pivot joint. In this joint, the cylindrical surface of one bone rotates within the ring and formed on the bone and fibrous tissue of a ligament. The movements of such joint is limited to the rotation around a central axis. So there is a pivot around which the rotation of the bone takes place. Pivot joint, this is the joint between the proximal ends of the radius and ulna. Pivot joint is also a joint between the atlas and axis. This functions at the head as neck as the head turns from side to side and up and down. Saddle joint, a saddle joint forms between the two bones whose articulating surfaces have concave and convex region. Surface of one bone fits the complementary surface of the another. This physical relationship permits a variety of movements, mainly in the two planes. Saddle joint is joint between carpal and the metacarpal of the thumb. Movements allowed by the synovial joint. Every skeletal muscle of the body is attached to the bone or other connective tissue that no fewer 2 points. The muscle origin is attached to the immovable bone. Its other end, the insertion, is attached to the movable bones. The different movements associated with the different joints. Gliding movements, they are translational movements which are simplest and joint movements. Back and forth, side to side, these are gliding movements. Angular movements are increase or decrease an angle between the two bones. Flexion, bending movement that decreases the angle of joint and brings the articulating bones together closer. Bending of the head forward on the chest, bending the knee from straight to the angled position. In the diagram you can see the flexion and extension. Extension is the opposite of flexion, that increases the angle of the joints, bring the articulating bones apart from each other. Hyperextension, that is bending the part of the body past its straight upright position. Abduction, moving a part towards the midline, returning into the side of the body. Abduction is moving a part away from the body. Circumduction is moving the limb so that it describes the cone of a space. The quickest way to exercise many muscles that move the hip and shoulder, ball and socket joints. That is circumduction. Dorsiflexion and plantar flexion of the foot. Dorsiflexion is lifting the foot so that its superior surface approaches the shin. Plantar flexion means depressing the foot or pointing the toes. Special movement. Some special movement do not fit into the specific category and occur only in a few joints. Rotation, turning of a bone around its axis. It is the only movement allowed between C1 and C2 vertebrae, common at the hip and shoulder joint. Supination and pronation. Both of these refer to the movement of radius around the ulna. Supination means turning backward, rotating the arm so that palm is facing anteriorly. Pronation means turning forward, rotating the arm so palm is facing posteriorly. This is supination and pronation. Inversion and eversion. Both of these refer to special movements. Inversion means sole of foot turns medially. Eversion, sole faces laterally. Protraction and retraction. This is non-angular anterior and posterior movements in the transverse plane. Mandible is protracted when you jut out your jaw and retracted when you move back to its original position. That is protraction and retraction of mandible. Elevation and depression. Elevation means lifting a body part superiorly. For example, shrugging of shoulders. Depression is moving the elevated part inferiorly. That is chewing your food. Opposition. It is found in the saddle joint between metacarpal and the carpal. This is the action when you touch your thumb of the tip of the fingers to the same hand. So in this picture we can see abduction at the right hip and adduction at both the shoulders. In this picture we can see flexion at the left knee and flexion at the left hip, extension at the right hip and extension at the right knee. Here in this picture we can see flexion at both the hips, abduction in the shoulders, extension of the elbows, extension of both the knees. Here in this we can see flexion at the hips, flexion at knees, extension at elbows. Here in this picture we can see the movements rotation and extension at the hips. Here we can see flexion at both the knees, adduction at the shoulders, adduction of both the hips, abduction. This is flexion and rotation of the shoulder. So here we finish the joints chapter. Thank you.